How to work the Social Security Administration so you get all the benefits you're eligible in terms of retirement, disability, survivor benefits, spouse benefits, all the rest of it. I worked for the Social Security Administration for a few decades. I ran the third busiest office in the country, and I've been doing live Q&As, and I've got close to 400 videos on YouTube explaining all those programs, including Medicare, Medicaid, and to help you get all the benefits you're entitled to. That's my new mission in my semi-retirement. So today we're going to talk about the kind of exposed Social Security to kind of help you out to make sure you get everything you're entitled to. So the topic of the day, how this works, I talk about the topic of the day, which is Social Security Administration, exposing it to some extent. And then that should take about 10 or 15 minutes. And then I'm going to open it up, as I always do, with live Q&As. So make sure you type your question in chat there, and that way we can go ahead and get started. So I do a live Q&A several times a week. I think I'm on my 40th day of consecutive doing live Q&A, answering all your questions. And pretty much every day, I get a comment that the Social Security Administration, take your benefits early at 62 or take your benefits at 70, or because the Social Security Administration wants you to do this and the people at Social Security want you to do X, Y, and Z and stuff. And kind of implying that there's some type of, hidden conspiracy or ulterior motives. So I'm going to talk about that today. There is definitely one overriding motivation amongst Social Security staff. There's over 1,500 offices throughout the country, 60,000 employees. Actually, Social Security is at a 27-year low in terms of staffing. So that's why it's so difficult to get in, get your phone answered, and getting your claims approved and everything. It's the staffing is very, very difficult. So we're going to talk about that, and with every, entity, business, agency out there, you got 60,000 people. In my experience, being on the inside, I had close to 100 people in my office. Again, staffing wise, I probably, with the work we had, the third busiest office in the country, we should have probably had about 120 employees. We had at tops 100. When I left, we probably had in our 70s. So it's very difficult. The Social Security employees you've got so many demands because this is the year, 65 years old. This is in U.S. history. More people are turning 65 this year than any time in history, in U.S. history. And staffing is as low as 27. So it's kind of the perfect worst storm for all of that. All right, so let's put that aside, and invariably you're going to get 1 or 2% of Social Security employees that are going to be very, very bad, just as any other place. But as I always recommend, if you get a bad employee, please, 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 please complain, because I fired many employees, and the key that really got it was customer service. We had people pushing the button, doing incorrect claims and doing this. But when they started providing, bad customer service, which that was part of it, usually to fire a federal employee, it takes a little bit. So a lot of documentation. So usually about the second, third time, then that's easier to let that person go, as we used to say in the Marine Corps, give them the BCD, the big chicken dinner, the bad conduct discharge. So if you complain, that might be it. They've got number two, one more, and they're out of here. And you complain, so this person was rude to me. They treated me like this. Thank you. Thank you. This is the one we needed to get this person out of there. So please, please, if you have bad service at Social Security, please complain. All right. So the motivation of employees. I'm not going to talk about political motivation. I've talked about that before with the design, the politicians. I think, they're the politicians on both sides, they have to run for elections. So they appeal to the Wall Street billionaires and the investor class. And those people have wanted the Social Security Trust Fund for decades. They want Social Security money so they can go to Wall Street and gamble your money and your retirement and all that stuff. So they've been wanting it for a long time. So they want to get rid of Social Security and just make it all private investment. So we're not going to talk about that political motivations. I want to talk about the actual employees themselves. Employees, Social Security employees, just like all other people, their primary motivation is to, feed their family, roof over the head, pay for the kids' college and stuff like that. But in terms of their work motivation, just as every person out there, make their life as easy as possible, stress free as possible, which is impossible considering, the demands. We used to have meetings, staff meetings, and employees would say, "Well, we really need to reduce the amount of people coming into the office." It's like, all right, tell me how do you stop people from turning 62 and 65 and losing a spouse or losing a parent or becoming disabled? If you can tell me how to do that, then I'd be more than happy to go out into the community and get that done. That's not going to happen. In terms of, so the only other thing is we need more staff. Well, that's a congressional thing, so we can't do anything about that. That's budget. That's y'all pushing your Congress people to fund Social Security, your local Social Security office. Call your local congressperson and say, "Hey, I had to wait for 2 hours. Why don't you do something to fund? I don't care about the rest of the country. I care about my office. Why don't you fund? Get some people in the local office." And doing something like that actually might make a difference. So there's nothing that can be done in between. So everything is in the middle in terms of the staff. What is their motivation? Um, their big motivation, there's, as I talked about several times, there's 20,000 pages, over 20,000 pages of policy. There's continual updates and all the rest of it. The biggest motivation for Social Security employees is, I have to tell you this honestly, is to not make a mistake. That's it. Their biggest motivation is to not make a mistake because they've already got an enormous workload. And they tell you when you're hired by Social Security that it's takes you 10 times longer to fix a mistake than doing it right the first time. So if somebody comes in and you do something on the disability or the retirement or the survivor benefits or the spouse benefits, if you do something wrong, that person has to fix it. And it takes them 10 times longer to go back there and fix it. You have to do the recalculations and pay the retroactive and send the letters out to the person and all the rest of it. So their number one motivation is to not make a mistake. And people always say, I know some people, I go into an office and somebody didn't like me and that's why they denied me. And no, it's Social Security employee. I'm sure there's 1 or 2%. We actually had one person in our office that was very opinionated, and we used to keep it to yourself. Old Marine Corps sergeant. If I wanted your opinion, I'd give it to you. But anyway, so we moderated that person. But yeah, there's invariably people that are, people are people. But Social Security employees are not supposed to give their opinion on things like that. You often hear people go into the Social Security office, "Oh, they looked at me funny because I came in and applied for disability, or I applied for SSI, or I applied for this early," or something like that. Social Security employees, again, 99% don't make judgments like that. Th- don't feel bad about going in there and filing for disability or SSI or early retirement or anything like that. It might be unique to you. It might be obviously a life changing situation for you, but the person on the other side of that desk, the other side of that window, has done that, thousands of times. Their number one motivation is to take your claim and the other 15 claims they have that day and make sure they don't make a mistake. So they don't have to, reopen it later and fix it. And so if someone gives you attitude like that, I think it's, probably that particular individual, bad day or whatever the case might be, but complain. And that way that person can be addressed and taken care of. But from my experience and from experience of a lot of people out there, I get tons of comments, a lot of people coming to live Q&As and they talk about this, and it takes forever, but all in all, the customer service is as good as it can be expected considering the workloads and the staffing and everything. But that leads into an issue, is that because Social Security employees are supposed to be neutral, and if they're not, again, complain. They're supposed to be neutral. Keep your opinions to yourself. whether I should apply for disability or early retirement or SSI. Don't give me the side eye when I come in there and do that, right? If they do that, complain. It's none of their business. They're supposed to stay neutral. But the problem with neutrality is, let's say, for example, on about up to about 10 years ago, when you came in for early retirement, Social Security employees used to give you a break even analysis. They would say, okay, well, if you start at 62, here's this, but if you wait till your full retirement age, here's that. And they say, okay, so you divide the early checks versus how much you would receive. And so it would take you about, I think, 14 years to make up the difference. So you might as well just go ahead and file early. About 10 years ago, they stopped doing that. They don't provide break-even analyses anymore. Why? Because that's, kind of financial advice that Social Security shouldn't really be providing. That's a personal thing. So, which, there's good parts and bad parts to that, but Social Security, they want the employees to stay neutral in that. It's like you come in there, you have to know exactly what you want, whether you want to do it early or late. And it's Social Security employees, I don't know why they're doing this, but I can't say anything. Um, and that's one of the problems, is there's really no place else to go to get that kind of, those recommendations. And there is a place, that there is an organization. There's a couple of three of them, and they provide like a 2-day online seminar. So you do this little 2-day online seminar. Again, remember 20,000 pages of policy and 2-day seminar. And once you do this 2-day seminar, this educational organization, I'm going to use scare quotes there, educational organization gives you a cute little certificate that says, now you're a Social Security expert. Go out into the world and cause chaos and havoc. Give people recommendations based on 2 days of seminars. So yeah, and they charge like $300 or $400 or something for their time, for 30 minutes, an hour, or something like that. So yeah, so going to Social Security, Social Security is supposed to help you navigate kind of the system, but you already kind of have to know where you want to go, because again, they have to stay neutral. You need an attorney, they can't say whether you need an attorney. Hire an attorney, don't hire an attorney. Call your congressperson, don't call your congressman. Do the split strategy or don't do the split strategy. They're supposed to stay as neutral as possible. So it leaves a lot of people out in the lurch, and they don't know which way to go. And so in my semi-retirement, I saw that need. I started doing these crazy videos, and close to 400 videos and lives every day, and hundreds of questions every day. Here we are. So I'm going to keep, as long as I can do this. I'm going to keep doing the live Q&As. But when you go into your Social Security office, understand the staffing issues, understand the workloads, and do everything you to help that person do the right thing in terms of providing good customer service to you, and then providing the documentation or whatever they need so they can get the case cleared, adjudicated, and you can get your money. In terms of for disability, I did like 3 or 4 videos on how to file for disability. I've had tons on whether you should do early retirement or delayed retirement credits. And I've also, a lot of my videos, I've also because one of the problems when you go to a Social Security office and you go in there and ask a question, you're asking a question that might be a kind of a difficult question, but you're asking it to, I hate to put it, the kind of the lower level. They're called customer service representatives. They're the hardest working, lowest paid, but they are not specialists on necessarily, the details of a particular program. So if you go in there, there's a lot of people getting incorrect information. They're calling the 800 number. They're getting incorrect information because their questions are a little bit advanced. They need to speak to an actual specialist, a claims specialist. And unless you have an appointment, you can't really speak to those claims specialists. So that's why I've done a bunch of videos on that. And some of those videos I had to actually provide the PALMS reference number, which is the policy reference number, to arm these people when they go into the Social Security Administration and say, and they say, hey, I want to file for independently entitled divorced spouse. And the person says, well, we don't have anything like that. And they just plop down RS 00202.003. Man, Didn't know about that. I was just hired last month, so sorry. So that person would have left and they would have lost benefits for the rest of their life. And a lot of people are losing benefits. So I'm going to keep on keeping on. Okay. All right. That only took 15 minutes. That's not too bad, right? And leave your comments, any type of experience you had with Social Security, um, any recommendations you have. And let's go ahead and get into some questions. Let's see. What is the first thing to do after SSA terminated my granddad's SSI without notification after a phone interview? He was 101 years old and lived on SSI. Wow. 101. Wow. Congratulations. Um, yeah. So SSI, that's the welfare based program. So you have to have limited income and resources for to get that. So did he move in with you and therefore you're providing some type of assistance? Did he get some money from wherever? Yeah, that would kick him off of SSI. So yeah, it's pretty easy to get off SSI if you get some other money from other places because it is a needs-based program. Karen, hi, thanks for the information. I've been waiting so long for the back pay awarded at the hearing. I've called and I'm told to call back in 60 days. What can I do? All right, yeah, back pay. So she was probably approved for disability and they went back however much long. And so what happens is the judge makes a decision, the administrative law judge makes a decision and they pass it to the writer. So there's an attorney or paralegal that actually writes up the order. And once they write it up, they give it back to the judge and the judge signs off on it. And then they send it to the local Social Security office and the local Social Security office is supposed to take action on it. But if there's SSDI and SSI involved, there's a rather complex calculation. They have to determine, how much you got paid in SSI and take that out. And if there's an attorney involved, they have to get their cut too. So yeah, unfortunately, it takes a while. Yeah. So all you can do is, 60 days. That seems like kind of a long. I would every 3 weeks I'd call up and say, hey, kind of I've been waiting for that money for like 2 years already. So see if they can expedite it in some way. That seems, yeah. Terry, that income limit before fraud is 22,000, but what does that mean exactly? Earned W-2 income only, or does dividends, interest, capital gains, or passive income like rental income count? So, wow, a lot of categories there. So it is definitely W-2 wages, not dividends, not interest, not capital gains, not passive income rental. Well, that possibly the last two. Um, if you're so it's earnings is either earnings W-2, wages you work for someplace, or if you have a business, net income from business from your business. And so that's why I kind of hemmed and hawed on the capital gains and passive income for rental. If your business is renting places, you've got a bunch of places that you rent and that's your business, that's income. If your capital gains, if you're just selling a house or something one time, then that's not earned income. But if your job as a realtor is to sell houses and that's what you do, is flip houses and that's your job, that's your business, then that counts. So it really depends on the categories of those particular things. Good time. Thank you for much doing this. You're welcome. Are they not paying the employees enough? Why can't they hire more employees? Yeah, I mean, yeah, the pay is the pay is good. The time off and the benefits and stuff like that. I've hired many Social Security employees, and each time we looked out for someone, we got hundreds and hundreds of applications, so we always had to do a lot of interviews. Um, but one of the problems is it's a tough job and it takes 2 years. Even if Congress woke up today and said, okay, we're going to give Social Security $1 billion to hire 20 people in every office in the country, you wouldn't see anything, any improvement for like a year or so, because it actually would go down, because it takes so long to train an employee to know that information. That's why that 2 day seminar, these people charging $400 for a Social Security meeting, is it's kind of laughable, because it takes a year or two for a person to be trained at Social Security. And in the meantime, when they're training, that means someone in the office has to train that person and supervise that person and monitor that person and check all their claims and stuff like that. So even if they Social Security hired a whole bunch of people for tomorrow, the service would actually go down a little bit until about a year or so, and then it would go back up again. So yeah, something needs to be done quickly. So, and then a lot of people just aren't able to do it. They're not able to grasp all that information, or they're too scared to push the button. And the fear of pushing the button, I fired a lot of people, because Social Security doesn't mess around. If you go in there and start looking at other people's records that you're not authorized to, like some famous person or your ex-spouse or something like that, done. You're out of here. Yeah. So I've fired a lot of people for looking at stuff they're not supposed to. So luckily, I have a very unique name, Weir. So sometimes Smiths in the office, and people come in with Smith names all the time, and they have to say, "I'm not related to this person. I'm not related to this person. I'm not related." So I only had to do that a couple of times in my decade. So not many Weirs out there. What am I entitled when applying for survivor benefits? Um, Kind of a broad question, but yeah. So in terms of survivor benefits, you can start survivor benefits at 60 years old, and you're entitled to up to 100% of your deceased spouse's benefit. And spouse survivor benefits gets kind of complicated. If your spouse never received benefits, or they waited till the full retirement age, you basically get 100% of what they were getting. If they got delayed retirement credits, you also get those delayed retirement credits. If they filed earlier, then the calculations get a little wonky. And if you file early, if you file at 60, then your benefits are also reduced as well. Anytime you receive benefits early, then yeah, benefits are reduced. My local office is not that busy, never waited 15 minutes. Wow. But they seem to be harassment thinking about filing 437 BK form, to incorrect overpayments, and 820 BK form. Yeah, so that's I think I did a video on that. Is Yeah, the Social Security, the office whack-a-mole, as I called it. So there's three things Social Security office is. It's either the wait time in the lobby, the phones, or processing claims. Two of those got to go. So the higher ups come down and say, you got to answer your phones quicker. So we take people from the front windows and processing claims, we put them on the phones, and the other two would suffer. Oh, you got to get people in your lobby, taken care of earlier. We take people off the phones and take people off adjudicating claims, and we put them at so yeah, it's kind of a whack-a-mole situation. So I didn't have to wait very much in that office, but yeah, then other issues. Harley, can I still stop my SSI payments after a year receiving payments? This April was, yeah, SSI. If you're talking SSI, the welfare-based program, yeah, you can stop that anytime. If maybe you were talking about Social Security retirement benefits rather than welfare. If you're talking about retirement benefits and you filed, yes, you have 12 months. So you can withdraw your application, and but you have to pay all that money back. So it's like it never happened. So you say, oh, I changed my mind. I don't want to, get my benefits. I'll wait till my full retirement age, or 70. So completely negate what I did 12 months ago, and you have to pay all that money back. Let's see here. Oh, okay. So someone has answered other people's question. All right. I like it. Oh, Harley Quinn, 49. Appreciate the super chat. Appreciate the supports. I do appreciate it. So if you're under 60, this means nothing. Well, I mean, not sure what this means, nothing. Um, yeah, I mean, if survivor benefits, you can get disabled widows benefits from 50 to 60 years old. There's also just straight disability at pretty much any age. So, oh, and somebody became a member. Thank you, silver member. Appreciate it. Or L. Thank you. All the support is greatly, greatly appreciated. Jimmy Johnson, I received my first second Social Security check on the third of the month, but based on my birthday, the 20th, it should be the third week. What do I do and why it's on that date? Um, yeah, so yeah, usually on your birthday, it's based the if you're new to Social Security, but if maybe you're for receiving benefits before, SSI is different, but regular retirement, um, if you were born in the first 10 days, you get your check on the second Wednesday. The second 10 days of the month, you get your check on the third Wednesday, and last 10 days, you get on the last Wednesday of the month. So either you were receiving benefits previously, or this is an SSI check. Yeah, usually they do it by that sequence. Let's see. It's my May and June checks, not separate checks. Yeah, that's another thing that happened this time is people that are entitled to benefits checks on the first, they got it a day early because the first is on a weekend, and that's all those guys out there that do their YouTubes and TikTokers, and they took advantage of that, and they made TikTok and YouTube and articles saying you're getting two checks this month. Click here to find out. You're not getting two checks. It's just one came a day early, so more clickbait there. So, all right, let's see. My granddad, oh, okay, had not changed his living arrangements for the past 18 years. No change in financial arrangement either. Should I file a reinstatement of the SSI while waiting to hear from him? Yes, yeah. So yeah, so it looks like he was receiving SSI, and there's no living arrangements, and there's no change in financial. So hopefully it was, yeah. I would definitely contact Social Security and say, hey, what's going on here? Why did the SSI stop? Did they get some type of notification from somewhere incorrectly that, he won the lottery or put some money in the bank account somewhere or something? So I would definitely contact them and find out what's going on. Mickey, can you get early Social Security at 58 years old? Uh, Not Social Security retirement. The earliest you can get Social Security retirement, straight retirement, is 62 years old. You can get survivor benefits at 60, and you can get disability at any age. Yeah, how horrible to do that a person that old. I agree. I agree. Yeah, that's not right at all. So yeah, call the Social Security Administration. If you can't get in, the next is call the 800 number. They should be able to see his record and find out what's going on. Hopefully, it's just some stupid little code that they forgot to clear or something like that, and tell them to expedite that check and get it. And what you can do is, if he really needs that money, you can actually go down. A lot of people don't know this. You can go down there and request an immediate payment out of the office. If you got direct deposit, then you can request immediate, and that usually takes 7 days because they have to do the Department of Treasury does the direct deposit. But if you're in dire need, usually dire need, you have an eviction or something like that, or your electricity is going to be shut off, you can go down to a local Social Security office, and if your payment is due, you can get a check out of the office. But when you do those, you get a check out of the office. It's not like a treasury check with the Statue of Liberty and all that kind of stuff. It's an internal check, and they have to provide a letter because when you take it down to the bank always thinks it's fake. So they will provide a letter to go along with that check, and it'll have the phone number for the local office. And it always had my phone number. So when we did checks like that, the bank would call me and say, yeah, Don Ricky is down here, and he's got this weird looking check, and I just want to make sure it's up and up. And I said, yeah, 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 we just gave it to him, and yep, he's good. We messed him up, and yeah. So make sure you get that letter, or you'll have to go back. Terry, my brother is recovering from cancer. Wow. Recovering, I guess that's good. So yes, that's good. So the being able to return is not determinable. Any recommendations for cancer survivors? Um, yeah, if you know, hopefully he's filed for disability if he's not able to work because I'm not sure what stage or what kind of treatment he's going through. But yeah, if you're not able to work because of a disability, I would definitely file for disability benefits. And if he's 62 years old, he can also file for retirement at the same time while he's waiting for his disability to be approved. Yep. Don, would $100,000 inheritance affect your SSDI? Would this count as resource income? Nope. SSDI doesn't care about resources or income. Well, it does care about income. It work income. So if you get an inheritance on SSDI, $1 million inheritance, doesn't matter. Doesn't matter at all. If you're on SSI, then yes, it does. But SSDI, nope, nope. Congratulations. Make sure you buy me a beer. All right. My last name starts with N. What day of the month should I get my Social Security? Yeah. It's not by your name, it's by your day of birth. So first 10 days, second Wednesday, second 10 days, third Wednesday, like that. Let's see. SSW. SSW. I think it's the first time I've seen SSW. Hey, how's it going? Welcome, welcome, welcome. I'm 59, receiving SSDI. Can I file for survivor benefits and decide I want to switch? Yes and no. Yes, you can absolutely file for survivor benefits, but I wouldn't switch. If you get survivor benefit, if you get survivor benefits, you're entitled to survivor benefits, and it's more than your SSDI. They just tack that on top of your SSDI. You become dual entitled. So I wouldn't stop your disability benefits because you might have Medicare tied to it and stuff like that. But I guess there is an argument for if you get survivor benefits. Let's say you're receiving $1,000 for SSDI, and then you get survivor benefits, and it's $2,000. Then you could say, okay, I want to get off disability. I'm good with survivor benefits, and that would end the whole CDRs, and you'll still have to you still have work requirements, but they're not as stringent as SSDI work requirements. So yeah, that's definitely something to kick around. But you also have to take into consideration, your Medicare. Make sure they tell you that okay, your Medicare is going to continue even if you go on survivor benefits, and so all that kind of stuff. That's important too. So yeah. Terry, what about unemployment insurance payments? Does that count toward my income limits? For SSI, yes. For everything else, no. So it doesn't matter because it's unearned income. So it doesn't count for the early retirement annual earnings limit. It doesn't count for if you're on SSDI. The only thing would count is the SSI, the welfare-based program. Nobody's answered my questions. They misunderstood my question. Oh, did I misunderstood your question? Let me go back up. Jimmy. Oh, okay. It is my May and June checks, not separate checks. Oh, okay. About the payday. Yeah, I'm not sure. That sounds, yeah, that sounds strange. Again, they paid two checks in May because June fell on a holiday, so that's strange. Well, it's not strange; it happens. So, but yeah, if you receive it on the first, then that's usually SSI or people that were grandfathered in. Quite a few years ago, if you were receiving a benefit as a child and you received it, on the first or something, sometimes when you filed, 30, 40 years later for retirement, they keep the same pay date because that's what's kind of in the system. So, yeah, so it's kind of strange how sometimes that works out. And unfortunately, we used to be able to change pay dates. People would come in and they say, hey, me getting paid on the third Wednesday of the month, I get charged for rent and late rent and all this kind of stuff. Can I change my date? And for like really, really emergency, very, very, situations like that, we were kind of able to do it, not very often because it's a Department of Treasury thing and it messes them up. But now I have, yeah, if I've heard that it's impossible to get your pay date changed. So, Ramoni, I have been married for over 10 years, twice. First husband is deceased, and I will be 60 in October. What benefits will I be entitled to, and what are your recommendations? So I would again the you there's an annual earnings limit, so you have to stay under $22,320 this year. Anything over, Social Security will hold back $1 for every $2 you go over. So as long as you understand that, then you are currently not married, hopefully. If you are, then you can't collect on your previous unless you were remarried after 60 years old. But yeah, if you're married for 10 years and he has since passed, you can collect for survivor benefits starting in 60. So, in very soon, a couple of months before October, I would call Social Security, set up an appointment for a survivor claim, and find out how much the benefits are. And you can't file for benefits on your own record. You can't do that until you're 62. But even then, the strategy is you collect survivor benefits and you don't touch years and you just let years increase 63, 65, 70, if you want to, and you just stay on survivor benefits. And then one day when your benefits get to way higher or whatever, you jump on your own. But yeah, so I would definitely call a couple of months before October, schedule an appointment, go over the numbers, and yeah, check it out. Oh, she says she's, oh, wait, okay, no, that's someone else, but 69. Anna, I currently receive SSDI, but am 51 and eligible to receive survivor benefits from husband. I was married for 13 years. Should I file now? Yeah, that's only disabled widows benefits, and there's different limitations on that. You had to be just found disabled within 7 years. And but yeah, I would definitely check it out to see if you're entitled to disabled widow benefits. Switch from disability on your own record to disabled widows benefits, and call Social Security. And again, take it, just don't call Social Security and whatever the person on the phone or the front window says. Those are not specialists in what's called Title II. There's two programs in Social Security. There's Title II and Title 16. Title II is disability insurance, retirement, survivor, spouse benefits. And then there's Title 16, which is SSIs, Title II and Title 16 of the Social Security Act. And as Title 16 is SSI, the welfare-based program. So you need to talk to a Title II CS, a Title II claim specialist, and they need to determine whether you're eligible for disabled widows benefits. Don't just take the word of someone at the front office, at the front window. So, last question. I just started benefits. It's my amount based on age 65. All right. Um, no, that's full retirement age is not 65 unless you're, in your 70s or 80s. Your full retirement age is probably what, 66 in some months, or 67 or so. So your benefit amount, your PIA, your primary insurance amount, is your amount at your full retirement age, not 65. Doom Pigeon, I think the first time here, getting a lot of new people. I like new people. That means y'all are doing the right thing and sharing this information so people get what they want, what they need, struggling out there. Is there a time limit for filing for SSDI in relation to monthly work credits? I don't understand that. If you qualify, does time not matter to file? Okay. Well, time always matters because it takes so long to get your claim approved. So do it sooner rather than later, because you're going to be waiting, 6 to 9 months to get your initial decision anyway. So file. And then you might be referencing what's called currently insured. So there's insured, whether you're insured for SSDI, Social Security Disability Insurance. Are you insured for that? Did you pay 10 years, 40 quarters? If you're young, 20s and 30s, you don't have to pay all of those quarters. There's different exceptions. But most people, 40s, 50s, 60s, or whatever. You paid the 10 years. Okay. That's if you paid 10 years, doesn't matter how old you are, you could be 80 years old, it doesn't matter. You paid your 10 years. The currently insured is you had to have paid any five out of the last 10 years. So the idea of currently insured is, you work in your 20s and you paid 10 years in your 20s, and then you take off and travel the world for the next 30 years. And then you come back to Social Security and says, yeah, I want to go back to work, but I'm disabled, so I can't go back to work. So I want to file for disability because I can't work anymore. It's like, wait a second, you haven't worked in like 30 years. So that's what kind of currently insured. You had to actually have been working five, any five, not necessarily consecutive, not the last five, but any five out of the last 10 years. So Social Security will come up with calculations called the DLI, date last insured. And if you became disabled after your DLI, the date last insured, then yeah, no benefits, unfortunately, except for maybe SSI, the welfare-based program. Um, Also, I have been on SSDI even during my marriage to him and after divorce. Okay. Yeah. So yeah. Okay. So this is about the disabled widows benefits. Yeah. Then yes. Um, All right, but there was an income letter dating back to 1981 where I graduated from college, but I'd drawn on my deceased. There we go. Yep. As a teenager, could that be the reason? Yes. Yep. That's it. You're in the system as that particular pay date, so you're kind of locked in. Yep. All right. All right. Or L. I am 68. My husband is 73. He earns $2,600 and also have child support monthly 65. I don't get Social Security because I'm married and no SSI. I brought in to SSI the child support court case and they say not. All right. So yeah, it's all right. Let's see. P. Saul was diagnosed with MS in 2011. Wow. Didn't have any of the symptoms. I chose not to take their experimental drugs, was fine until the fall 3 years ago. Everything kicked in. Applied disability. You're waiting. Okay. Yeah. MS is, and I'm sure you know, it's very difficult to diagnose and whether you have that. And so it's one of those that's difficult for disability. There's certain ones that, back pain, any mental issues, MS. There are certain ones that are just more difficult than others. Carol, I was told that if I am collecting Social Security and my husband is collecting SSDI, that I will be able to claim a portion of his Social Security. Is this true? Yeah, if he's 62 years old, you're entitled to benefits as a spouse benefits. Absolutely. So I would definitely call up and see if there's any benefits. Again, I wouldn't take the the pat answer from anybody on the phones. I would actually schedule an appointment and talk to an actual Title II claim specialist. Jess, what's up, Jess? I'm happy to be here, and we're happy to have you. I'm 35 and have SSI, SSDI, and I'm beyond struggling. Wow, Jess, make sure. I think you've been in. You've dropped in before, but I always want to make sure the four videos I did on living on Social Security alone. There's like 47 programs in there. One of them has gone away, but there's 47 programs in there, ideas that might make your life easier. And as always, I apologize for the super long, boring intro in the first one. So just skip the first 5 or 10 minutes, my boring diatribe, and just get to the good stuff. So make sure you watch those. Today, a rep told me I get a temporary payment within 7 to 10 days while they await proving that this disease is still there. I don't know. Um, yeah, sometimes they have immediate payments like that, kind of a compassionate type thing. So, yeah, if they said it, hopefully they follow through with it. Hey, Don Ricky, bought me a beer. Thank you very much. It's, even in the Marine Corps, I was one beer Weir, so I'm good for the day. Such a lightweight. They say they don't deduct child support. No, yeah, no. They can. Social Security only deducts stuff like that if they have a court order. If they have a court order directly from the court that says you will deduct X amount of money for child support or for alimony or whatever the case may be from Social Security check, then Social Security has to abide by the court order. But they don't do it, just because whoever, it has to be a court order. A friend is on SSDI. He is receiving residual income from insurance sales. Can he receive SSD? Yeah, the residuals. That's work that he did prior. He's going to have some issues on that because the computer system is not smart enough to recognize, you know, the money coming in. But it depends. I guess it depends on the kind of the nature of the insurance. If it requires some type of maintenance to keep that money going, but if it's like, royalties where we had a bunch of people, acting and, when they were kids and still get, several $1,000s a month from the movie. And so that would trigger, an alert in the office. Hey, this person is receiving, Social Security disability insurance, but they're getting money coming in. And the person just, yes, yes, yes. And remember that one movie, that one kid that said that annoying thing? Yeah, that was me. And I'm still getting money. And oh, okay, that's where the money comes. Okay, all right, good. So he might have to do that. That one judge on the movie Casino with Robert De Niro? Yeah. Not Oscar Goodman, the other guy. Orange Blossoms. Hi, my question is about W2Gs. Occasionally, I play the slot machines, and sometimes there are winnings, but most of the time, losses. Yes. Does that add to my income through my win-loss or just break even? Okay, so it really depends what it is. If it's SSI, welfare-based program, all bets are off on that one. But in terms of early retirement, in terms of Social Security disability insurance, no, with an exception, right? Social Security, there's exceptions, the exceptions, exceptions. If you are a professional gambler, if you are a professional slot machine player or poker player, Pyga or whatever the case may be, if you're a professional and that's your job, then that's your job and that's income. But if you just, just do it and sometimes you win, then it doesn't count. SSDI sporadic grants for housing. I only receive $900 monthly for me and my child. Yeah. So I would definitely keep an eye. And so wherever in your particular area, HUD or wherever the case may be, or your local county housing authority or city or whatever the case, I would call them up like first time, first part of next week, never Mondays, never calls, federal offices on Mondays, like Tuesday or Wednesday, call them up because the federal budget just gave a lot of money. One of the big issues in this country is affordable housing. And so the federal government just sent out a lot of money to the states, and that money is reaching the states, and the states are giving it down to the local counties and cities or however they do it, depending on the state. So now is the good time, a very good time to reach out to those agencies and say, hey, remember me? We need this, that, and the other. So now is the time to do that. When you make your phone appointment, is that when you inquire about speaking with a specialist? Good question. So with almost all Social Security offices, they only make appointments if you're going to file a claim. So that's kind of the trick you have to kind of recognize is that if you're just going in there and you have an overpayment or you have a question or something like that, you can't, 99.9% of the offices, you can't schedule an appointment. You just have to, call or walk in. So you have to have an appointment to actually speak to a Title II or Title 16 claim specialist. And in order to get an appointment, you have to, unfortunately, have to have a claim that you want to file. But having an appointment to file a claim and going through the claim process and pulling the trigger, adjudicating the claim are completely different things. So as I always recommend, you go into the Social Security office and you think about, early retirement, or you think about getting your survivor benefits at 60 on your own, holding off and do all that kind of stuff, schedule an appointment because that's a claim. Schedule an appointment, have them run the definitive numbers. That's why I say, these organizations that charge you $400 or $500 for the numbers, they're always wrong. Get the definitive numbers from Social Security, and then if it sounds good, say, okay, let's do it. If it's you want to think about it, or you say, okay, how much is it next year? Oh, I'll come back next year. You're good. Social Security employees will always be happy. They love to hear, all right, let me think about it. Or, nah, no, I don't want to do it. They love to hear that because that means they don't have to take your case back to their desk and adjudicate it and go all through that stuff and maybe make a mistake, and make their life miserable. So if you say, no, I'll come back next year. See you then. Yeah. They're very, very happy. So it makes their life so much easier. So don't be stressed about, not filing at that time, and whether, they're going to, oh, why aren't you doing it? Yeah, they're not. Why aren't you buying the car today? No, they're not going to do that. So they'll actually be happy. So let's see here. Okay. Thanks. That must be what they're talking about because I am in dire need. And he did say within 70 days it will hit my account. Okay, perfect. Yes. So yeah, they can do a check out of the office, but it's a little bit more difficult. Have to jump through a few more offices. But in terms of an immediate payment, direct deposit into your account, that's easier to do. What happens if you become an expat? Are you required to pay for Medicare? All right. So yeah, I get this question a lot. I've done a few videos on this, but so I mean, old Marine Corps sergeant. Nobody, you don't have to do anything in life, but the repercussions are. So if you're going to move overseas and you're never ever going to come back, and you're never going to be homesick, and you're never going to have to come back for medical treatment, and you're never going to, the political situation in that country is always going to be perfect and rosy, and visas and all that kind of stuff. You're never coming back. Then no, you don't. You don't have to sign up for Medicare. But if you ever do come back, that's when you'll pay the penalties. 10% for every 12 months you did not have Medicare. And Part D, there's a penalty on that as well. And you can only sign up during the general enrollment period, January, February, March. So if you get sick in July overseas and you have to come back, you have to pay everything out of pocket for 6-7 months until your benefits start. Medicare starts February 1st, which is the earliest it would start. You sign up in January and it'll start February 1st. That's a change from a couple of years ago. They just changed the law on that. It used to be you signed up January, February, March during the general enrollment period, and your Medicare didn't start till July 1st. They changed that, which was a good thing. All right, Christine, if I started on Medicare, but waiting until FRA at 66 and 8 months when to file, if that's November, and do they automatically start taking out Part B from Social Security? Yes. So if you already started on Medicare and you're paying it yourself, every 3 months or through Easy Pay or something like that. Yeah. Once you actually start filing for benefits, then they'll start taking that automatically from your Social Security check. And don't sweat that 1 month. There's going to be like a month of overlap where you've already paid for that month and then they take it out of your check again. You know, just give it about a month or so until the computer system, the Medicare computer system, the Social Security the Social Security system realizes that 2 payments were made for 1 month, and they'll give that back to you. So yeah, don't sweat that. And remember, Medicare is always paid the month before. So if it's, if your Medicare is going to start in June, you pay for it in May. Social Security benefits, your benefits start in June, you'll get your money in July. They always pay a month late because they always want to catch that check at the end. And there's always an end for us. Ramonia, thank you. You're welcome. Light of the Moon. All right. First question. I don't think I've seen this person. My husband died 420 up. So wow, sorry to hear that. He was on SSDI for a bit over a year. So let's see if there's another part to this question. Light. It says it's too long. I will not, oh, it says that my question is too long. I will not post it. Yeah. Are you on? Let's see here. Yeah. Yeah. So you might have to. Oh, office, do you have to report retirement to limited care? Oh, $10 super chat. Thank you very much. I appreciate it. Appreciate it. Do you have to report retirement to LTD limited carrier? Not sure what limited carrier is. Yeah, let me know what limited carrier is. Not sure what that is. Well, my husband, 73, is not a citizen, but he pays taxes and eligible for Social Security. I am a citizen and we got married 6 months ago, but Social Security said he isn't legal. He can't get his Social Security, and isn't he? What may we do? Yeah, you have, contrary to, the internet, you have to have legal status in the United States to get Social Security benefits. "Hey, give it to the illegals." Yeah, no, no, no. You have to prove your U.S. citizenship or naturalization, or you're in the country legally, a green card and stuff like that. Yeah, unfortunately, he needs to get legal status. So there is a lot of people, the same people that, they're giving all the money to the illegals. Actually, it's all the illegals are giving money to us, because people come in the country illegally, and so they go to the swap meet and get a fake Social Security card. And the issue is when they go to their employer is supposed to check that, but the business wants the employees, so they just kind of, "Oh, okay, it looks all right to me." And they pay that person, and they withhold FICA taxes, so that person pays into FICA, like probably your husband paid into Social Security for years and is got all that money there paid into it. But unfortunately, he will never collect it. And billions of dollars are in the trust fund that, is helping the trust fund. But unfortunately, until he becomes a green card holder or naturalized or whatever the case may be, unfortunately, he will never receive it. Yeah. Um, Let's see here. Kathy, I need to ask you a question, but it's too long for the chat. How can I ask it? Yeah, the 99.9% of my help is always free, and I do it through this. But for 1 or 2 times a day, I do have scheduled calls. But to support everything, I do charge for those, because all of this stuff takes money. And my wife says, stop using our retirement money. And the wife says, that's the law. Had to retire at 62 from auto accident. They took 30% from my Social Security payment. Yes, yes. Yes, when you file early at 62, yes, they will, But if you retire because of an auto accident, then you should have filed for disability, not retirement. And if you filed for disability and were approved, then yeah, you would have gotten your full amount, not a reduction. Mark says, so sorry to hear that. Yeah, wow. We got a lot of nice people out there, compassionate people. I like it. Will cashing out my IRA affect my Medicaid? The fact that you have an IRA might be an issue in and of itself. If you're talking Medicaid, the Welfare Income Resource Limit, state program, then that's a welfare-based health care system. So if you had an IRA and you didn't tell them, then that might be an issue. But if you have Medicare, that you sign up through Social Security, Medicare Part A, Part B, yeah, no effect whatsoever. Casey, excellent information. You're welcome. Thank you for service. You're welcome. Thank you. Thank you. Barbara, the Black Pixie. I like it. I've been receiving SSI since 49 on my own record, and I'm 63. I will be 64 in October. My husband is 7 years younger on the same day. All right. So SSI, the welfare-based program, or SSDI? Let's see. Janet, I am on SSDI. If I feel better, can I work part-time without jeopardizing my SSDI? Yes, absolutely. Social Security always, incentivizes people to go to work, to try to work. And one of the things they do is they have this called the trial work period, where it's 9 months. You can work, make $1 million a month, and it's not necessarily consecutive. You can work a month and then take off 2 months and work another month, but 9 months you can make as much as you want to try to work. That's why they call it trial work period. Absolutely. And then after that, there's the extended period of eligibility, which is 36 months. And every month you go over your the SGA, the substantial gainful activity, they will withhold that check. Um, Surely, can I collect divorced Social Security from ex-husband without starting mine? No, you have to start benefits on your own record, unless your ex-husband is deceased. Then you can file for surviving divorced spouse, um, and not file on your own. But if he is still out there alive and kicking, then yeah, you have to file on your own first. I have dyslexia. Can I get SSI? Yeah, if it keeps you from working, dyslexia, it's be kind of a tough one. But you never know. Maybe you've got other issues bundled together that might make you eligible for disability. If it's something that keeps you from working, then definitely apply. Carol, my husband is 10 years younger than me. Do I still have to wait till he is 60 for me to claim part of his Social Security? No, you have to wait until he's 62. And so I assume he's your current husband. So he has to file for benefits for you to collect. You are amazing. Thanks for your service. I appreciate it. All right. We are over an hour, and let me get to one or two people that I've new people that have never asked any questions. I think have not asked any questions. Let's see. Got one. Let's see. Do you have to pay taxes on back pay SSDI? They sent me paperwork which included the attorney payment. Yeah, I don't do taxes. That's an IRS thing. Let's see here. New people. Oh, lady, thank you very much for all you do. How does one find out if their local Social Security office is staffed at 70% or 100%, or is a good one or not a good one? Yeah, it's just yeah, it's hard to tell what the staffing is on each particular office. It fluctuates all over the place too. Um, but one thing I think I should talk about more often, remind people is some people have a problem with their local office, the one near them. Maybe the line is too long or something like that, or they just don't like the location. You don't have to go to your local office that's dedicated to your zip code. If you've got another office, on the other side of town or something like that, a Social Security office, I always tell people, when you go into the office, they'll say, "Hey, this is not your office. You have another office closer." And you say, "Well, every office in the country is my office. So you paid your FICA taxes. You can go to any office in the country. So you can go to any office in your town. But if you're receiving SSI and you have a pending claim and stuff like that, I'd probably stick to the same office, unless they just treated you completely wrong and you just never want to go there again and see that person. Then you go to another office and say, "Hey, I want to use your office from now on. Can you transfer my stuff?" And they say, "Well, this is not your office." And I'm like, "Yes, every office in the country is my office." That's one of the reasons my office was the third busiest in the country. Is we had two other offices in the same town, but yeah, people found out that I was a jerk and made people do what they were supposed to do. And now I had awesome staff, so that's what it's all about. Kevin, my first wife after 20 years. I am remarried 18 years. Can I draw on my first wife since I remarried? I am 62. Probably not, the way it's written here. So you are, if your first wife is deceased and you were remarried after 60, then yes. But i- if both of those are no, then no. All right. Oh, long-term disability. Okay, there we go. LTD. Okay, long-term disability. It says L. Okay, okay, LTD. Yeah, LTD. Um, I should have caught that, huh? Anyway, yes, that you are receiving. It really depends on. Yeah, it really depends on what long-term disability, whether it's a state program or it's a private company or something like that. But I would definitely notify them to be on the up and up. Um, it doesn't affect Social Security. The only time anything like that would affect Social Security if it's workers' comp from like a state public disability benefit. But if it's just like work-related long-term disability, Social Security doesn't care. It's no relevance to Social Security at all. But on the other side, that particular company, yeah, sometimes they try to, get out of pain and they will offset what you get from Social Security and pay you less from your long-term disability. And so it really depends on how your company negotiated the contract with the long-term disability company. So I should have caught that, what LTD was. Sorry about that. Um, all right, let's do two more here. I'm also a long COVID hauler. I still have the leftovers of COVID pneumonia. It's been 2 years. And I also still have no sense of smell and taste. Do I qualify for disability? Again, with all disability, if you are unable to work because of your conditions, then definitely apply. It doesn't hurt. And watch my videos, the 4 videos I did on disability, and it'll give you, a lot of kind of inside scoop. Became a member, silver member. Thank you, thank you, thank you. I appreciate it. All right, let's see if there's anybody. Let's do one more that I don't think has ever shown up. Uh, they play too many games and hang up on you. Ah, Wanda. Yeah. We had someone in our office and yeah, she has since passed away and she used to, yeah, I'm like, because I looked at the stats every day and see how many people were answering phones and how many calls they answered. And I'm like, wow, this one lady, she was really knocking out of the park today. She answered a lot of calls. And I'm like, wait a second, the average calls are like 30 seconds. So yeah, we immediately, yeah. People get away. You can't get away with stuff. There's too many reports on everything. I have been waiting on my back pay for 2 years for SSDI and my SSI is suspended. I never received what to do. Yeah, wow. Waiting on back pay for 2 years. That's way, 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 way too long. Yeah, 2 years. If you've got a valid back pay that's due you, and here's the one, the final the final card you can pull out in really, really severe cases. If you've tried everything from Social Security to get stuff done, like, waiting for 2 years for back pay, then again, this is one of those things that, what this kind of my first part of this was all about. Um, then I would reach out to your local congressperson, your federal one, not the state, or the one that goes to Washington, and go onto their website. And on all their websites, they have, I need help with a federal agency. So you click that little button, you fill it out, you send it in. They don't read it. They just say, oh, this is for Social Security. And they send it to Baltimore, the headquarters, and the Baltimore sends it to the region, San Francisco or Dallas or wherever. And then the regional office sends it down to the local office. And then those have to be tracked. So a response has to be made within like 24, 40 hours that, hey, we reached out to, Clio, and we talked to them and we told them this, and we're going to do this, that, and the other. So that's, yeah, that's a strategy that you can use to really light a fire under your local office and get your case taken care of. All right, that'll be it for the day. I will be back tomorrow. So if I didn't get to your questions, I apologize, but ran out of time. So cut and paste your questions. I'll be back tomorrow. And then before we even start, just go ahead and put your question in the chat, and that way I can answer it first thing tomorrow.